The debate over opening schools is raging across the country. The CDC recently said it was safe to have students in the classroom if precautions are taken. But many teachers and unions disagree. Meanwhile, the Biden administration says reopening the majority of schools nationwide is a top priority. I want to bring in Dr. Tom Frieden to talk about all this. He is the former director of the CDC and the president and CEO of Resolve to Save Lives. Dr. Frieden, good to see you again. On top of all of this, a lot of students are falling behind with remote learning, and some are suffering emotionally from being isolated. So in your opinion, do you feel it's safe to open up schools, and do teachers need to be vaccinated in order to do it, or can they go in without having received the vaccine?
Well, first off, let's say that teachers are priority for vaccination. And most states have opened up vaccine for teachers. There's not enough vaccine to go around yet. But it's also very clear that schools can be open with a reasonable degree of safety without vaccination there. So we can't hold up reopening schools for vaccination. To do that would essentially be giving up the rest of this school year for most of the country. And the fact is that we've seen very little spread in academic settings in schools. Most of what we see is spread in the community. We haven't seen schools, particularly K through 8 schools, as significant sources of spread. However, it's important to do it carefully. There are things that we can do to make schools safer: masking, more ventilation, distance, and special precautions for students and staff who have underlying health conditions.
I want to ask you about something else. Politico reports that the Biden administration is trying to figure out where about 20 million missing vaccines are. Can't find them. These are shots that have been distributed to different states, but they haven't been administered. How is it that these vaccines could go unaccounted for? How can vaccines go missing? And then what needs to be done kind of moving forward to make sure that a situation like this doesn't come up again? How do you track them?
There's a lot of confusion. With the transition, it's usually handing off a baton. When it came to a plan for how the whole country would implement a vaccination program, it turned out that there was no baton to be passed between the prior administration and the current one. There really was just throw it to the states and hope it goes well. The current administration is working with states to establish a systematic way of increasing vaccination throughput. And that means both making sure that we get vaccines out of freezers and into arms as soon as possible, but also doing much better at equity issues. We're seeing rates of vaccination in the Black community that are half what rates of vaccination are in the white community, despite the fact that Black Americans are 2 or 3 times more likely to be killed by COVID as white Americans. So we have to both vaccinate faster and vaccinate with a better targeting on those who are at highest risk.
President Biden, Dr. Frieden, has signed an executive order that asked the government to figure out if vaccine passports, digital certificates showing someone has been tested or vaccinated before they get on a plane, are feasible. Do you think that this could allow people to start traveling safely? I know that, for example, when I was based in Africa, I still carried around a vaccination card that listed all the vaccinations that I had to get into certain countries in and around the continent, and they were very strict about it. If you didn't have your yellow fever vaccinations, you couldn't get in. Could that be something that we could see here in the United States?
Our organization, Resolve to Save Lives, has looked at this issue of vaccination passports carefully, and we think they're coming. It's inevitable, but they have to be done right. First off, they have to be opt-in. If you don't want one, you don't have to get one. Otherwise, people might be afraid to get a vaccination. Second, they can't cover natural immunity, or people will say, hey, I'll go get infected so I can travel now. And third, they have to be done with an ironclad privacy approach. As you point out, yellow fever vaccination certificates already exist, but there are problems with those. They're on paper, they're frankly easy to forge. So a COVID vaccination passport is going to have to be opt-in, private, and have very strong digital characteristics. And fundamentally, I think what we'll get to is that each country will have to have a way of issuing that, just as countries issue a passport.
You just mentioned the need for more vaccines to be distributed amongst minority communities, communities that, we have been told are particularly vulnerable to this virus. I want to ask you about some government data. on how the virus is affecting people of different races. It's not complete. The CDC's website says that they're working with states to provide more information, but the only data that they have right now are from states that actually report it, and not every state does. Why isn't the government tracking more racial and ethnicity health data? And can we talk about, why that is so significant to have that information?
It's really important. Earlier this week, my group, Resolve to Save Lives, issued a report with recommendations on what every state should report, including race ethnicity data in vaccinations, not only cumulatively, but over time. We only found one state in the country, North Dakota, that did that. But unless you do that, you don't know what's happening. You don't know whether you're reaching people who are most in need and whether that's improving over time. What we know from the scanty information that we have so far is that the rate of vaccination in Black communities is about half the rate in white communities. Again, despite the death rate being 2 or 3 times as high. To address that, we're going to have to get the data and publish it, but also reach into and work with communities, identify community leaders, identify the messages and the messengers that are going to be most effective at achieving a higher vaccination rate and addressing some of the valid concerns that people have about the healthcare system, about lack of access, about costs. There are a lot of questions that people have. We have to address those questions. But first and foremost, we have to make it convenient because there's a lot of reluctance, but the more convenient you make it, the better. The sad fact is that when you set a system up to be first come, first serve, you're going to exacerbate inequality because the people who are more internet savvy, the people who have more connections, they're going to get there. And we have to really consciously resist that kind of approach. So while we're scaling up vaccination, we also have to do a much better job at reaching in and working with communities at highest risk.
So, Dr. Frieden, you've no doubt seen Johnson & Johnson's vaccine candidate has been submitted to the FDA for emergency use authorization. The drug maker says the vaccine is 85% effective against serious COVID symptoms. You only have to get 1 dose, and it can stay in a refrigerator for months. The company also says that they expect to distribute 100 million doses in the U.S. in the first half of 2021. So what effect will that have, and how close could it put us towards normalcy?
This is great. It's great to have a new, strong tool. There's still information coming out on it. As you say, 85% effective within 1 month after just a single dose. What's interesting to me is that some of the scientific studies suggest that your immunity continues to build after that single dose for 2 months. So I think it's possible it'll be even better than 85% effective. How long it works and whether it will work against all of the different strains of the virus remains to be seen. But I think what we're going to see over the next few months is the follows. First, as vaccination kicks in nursing homes and people over the age of 65, we should see a substantial reduction in the number of deaths starting in March. Second, as vaccination kicks in more broadly, as well as at least 25, maybe 30% of Americans who have been infected, we may see case counts continuing to come down really through June and July. The wild card here, the big unknown, are variants. And what we're seeing from other countries is explosive spread despite vaccination, despite high levels of immunity when new variants come in. And that's a huge risk. That's why we have to double down on protection protocols. We can't take our foot off the brake. We have to maintain masking, limit indoor contact with others, and enjoy the Super Bowl, but please do so just with people in your own household this weekend.
Dr. Tom Frieden, thank you so much. Great advice. Appreciate your time.
Thank you.